Hello, I'm Jerry Marvel, Communications major at the University of Houston. Today, my classmate Sang and I would like to discuss the growing implementation of e-health and telemedicine technologies in the continent of Africa. E-health is a growing field worldwide, but the most exciting opportunities to see what the technology is really capable of lie in the many underserved countries and parts of Africa. But before we dive into what's happening in Africa, let's briefly describe what we mean when we talk about e-health, telehealth, and telemedicine, and how we define them for the purposes of this discussion. According to the World Health Organization, e-health is defined as the movement towards innovative healthcare delivery through independent telemedicine and telehealth projects to the worldwide distribution network known as the Internet. Telehealth is defined as the integration of telecommunication systems into practice of protecting and promoting health, while telemedicine is incorporation of these systems into curative medicine. Lastly, telemedicine is the diagnosis and treatment of patients by means of telecommunications technology. What follows are examples of each of these being implemented in Africa and whether or not they were successful at addressing health issues for the people of Africa.
The first project we'll discuss is eHealth Africa. According to their website, eHealth Africa is a non-profit organization whose mission is to utilize appropriate technology to effectively design, implement, manage, and evaluate health projects. eHealth Africa works closely with health NGOs in order to provide them with technology solutions that will enhance their ongoing and new health programs. They also work with government themselves in order to help them implement technologies and programs in their healthcare system nationwide. They have been pursuing these various projects and endeavors in Africa since 2008. They take particular pride in having implemented their technologies and programs in areas where challenges such as lack of internet and harsh conditions make the task immensely more difficult. During the years of their operation, eHealth Africa has formed strong relationships with other telecommunication organizations and many private companies that contribute to their work financially. eHealth Africa has received many awards from other organizations worldwide for their work on promoting ICTs in Africa. One of the projects of eHealth Africa is the implementation of solar technology for maternal health. Unreliable power throughout Nigeria, and especially in the north, makes it near impossible for health facilities to have light available for women that give birth after daylight hours. Torchlights, mobile phones, and kerosene lamps are the most widely used sources of light in these facilities, and yet these do not provide enough visibility to treat critical conditions such as eclampsia, postpartum hemorrhage, and resuscitating a newborn. Generators depend upon fuel, which in some cases must be provided by the health workers or patient families. eHealth Africa and We Care Solar, with support from MacArthur Foundation, work together on the development, installation, monitoring, and maintenance of microsolar installation in 28 facilities in Kano and Kaduna states. As a result of this program, data collected from November 2011 to March 2012 showed that over 62,000 women received labor and delivery services with the light provided by the solar systems. The solar system impacted the health facilities by increasing access to light during nighttime assessments and deliveries, as well as improving the attitudes of health workers that worked at night.
According to Jeremiah J. Moinga of the Global Health Corps, many other e-health and telemedicine projects are taking root in Africa. The article he wrote details many of the startup programs surrounding healthcare and using ICTs that were present at an e-health conference in Nairobi, May of 2013. One innovation, SmartCare, offers a touchscreen graphical user interface, or GUI, to minimize the learning curve and enable rapid data entry by clinicians, and the electronic health record is copied to smart cards for clients to own permanently, addressing broadband costs and infrastructure failures. It is essentially a more reliable, easy to use, and convenient method of medical record keeping, both for the doctors and the nurses updating the records and patients who have to present them. Another interesting tool called U-Report is used in Uganda to capture citizen feedback on community, health, and government issues through mobile phone-based data collection. With over 230,000 users, the service has great potential to enhance citizen engagement and government accountability and to improve health service delivery. And in Zambia, it's an innovative SMS platform designed by the National AIDS Council and UNICEF to assist in the diagnosis and treatment of AIDS in the younger generation.
Corporations are also hopping on the e-health and telecommunication revolution bandwagon in Africa, so the field isn't solely limited to nonprofits and charities. One of the companies is Inmarsat, a British telecommunication and satellite company. Inmarsat is currently hoping to develop, test, and deliver innovative telemedicine initiatives around the world, particularly in Africa with the help of Global Health e-Foundation. Inmarsat CEO Rupert Pearce signed a memorandum of agreement in Inmarsat head office in City Road, London on 5th, with the Earl of St Andrews George Philip Nicholas Windsor, a Global eHealth Foundation trustee. The move aims to connect healthcare specialists around the world with patients in sub-Saharan Africa and other remote locations, helping to break down healthcare barriers. The Global eHealth Foundation wants to contribute to rapidly growing eHealth revolution by working with the government to coordinate funding, education, technology, and advocacy. It aims to drive policy and provide access to healthcare services in underserved communities. They intend to make this possible by use of mobile phone apps and Inmarsat's extensive satellite network.
Inmarsat's AlphaSat satellite will be used to transmit real-time images used in telemedicine so doctors can diagnose and treat patients remotely without ever seeing them face-to-face. Launched in July 2013, AlphaSat is the world's most advanced civil communications satellite and was designed with the UK Space Agency and ESA to provide e-health and telecommunications services to developing areas. Archbishop Desmond Tutu is chairman of the Board of Trustees and an avid supporter of the program. Tutu said, "I am delighted that my Global eHealth Foundation is part of this inspirational endeavor to harness satellite technology to connect with those in need with those who care, helping fulfill our dream of transforming healthcare from a privilege for the developed world into a human right in the developing world." This idea of healthcare as a right has been growing in popularity in recent years, and the people in most need of this are in some of the areas Inmarsat is serving. Rupert Pearce, CEO of Inmarsat, said 24 out of the 26 nations in the world with the highest mortality are in sub-Saharan Africa. It's a region we've been focused on for several years with projects including a pilot with telemedicine platform VC in Gabon. We are delighted to be supporting the ambitious and laudable aims of the Global eHealth Foundation and hope that this partnership acts as a catalyst for technology providers and healthcare organizations across the world to become involved in such a vital task. According to the World Health Organization, the increase in technology and decrease in costs of effective and quality mobile phones is really spurring the e-health revolution. Governments across Africa, with the support of WHO and other partners, are integrating mobile phones in a range of promising applications, including applications that alert people to malaria and tuberculosis threats and outbreaks so they can act accordingly and modify their behaviors in order to prevent illness. In addition, mobile phone-based pregnancy support is used to educate women on pregnancy, monitor pregnancies, and provide critical information and updates. Other technologies that are being successfully implemented in other countries. In Rwanda, TrackNet, a web-based application accessible on both mobile phones and computers, shows data and government information about HIV. It thus gives the user a comprehensive view of the status, patient load, and drug supply of all the levels of HIV programs. Kenya has developed and implemented a system which enables residents with a mobile phone to upload a locally developed application that allows them to determine if a doctor or clinic is genuine. By simply sending an SMS, the user is shown up-to-date lists of licensed medical professionals and approved hospitals starting with those nearest to him or her. In Uganda, M-Track allows for the tracking of medical supplies to clinics in the country where 131 hospitals serve nearly 36 million people. This helps keep healthcare workers updated on what's going on in an often confusing system. Zambia and South Africa have both implemented highly updated electronic record-keeping systems that make things go much more smoothly for doctors and patients. Mali's eHealth Icon project enables rural clinics in the country to forward scans and x-rays to specialists for review through ICT connections. The specialists that review these scans make treatment recommendations without ever having to see the patient. In Mozambique, SMS reminders and educational messages sent to people with HIV help to improve the effectiveness of HIV treatment and prevention. At the regional level, the African Health Observatory at WHO AFRO supports regional and country efforts at strengthening health systems through its operations in a network of national health observatories. AHO works hard to make sure these technologies and services are made available to many people and implemented fairly. One point being made often is that healthcare would benefit greatly from implementing ICTs because other fields have in these countries, and it appears that this is the case. ICTs have given patients and doctors in rural areas access to information and treatments that could not be dreamed of before due to poor infrastructure and a lack of resources. Implementation is definitely facing challenges, ranging from geographical constraints to government bureaucracies, but the revolution has already started and will likely continue to grow and improve the lives of the people of Africa.